Hi, everyone. So, this is an introduction to injury prevention as a public health issue. And after this lecture, you will be able to define injury and violence, describe how injury compares with other leading causes of death, and describe injury epidemiology for both intentional and unintentional injuries. So, what are injuries? An injury can be defined as any unintentional or intentional damage to the body that results from acute exposure to thermal, mechanical, electrical, or chemical energy, or from the absence of such essentials as heat or oxygen. And so, breaking it down further, injuries can be conceptualized into unintentional injuries and intentional injuries. So, an unintentional injury is defined by the CDC as physical damage that occurs when the body is exposed to too much energy or lacks vital elements like oxygen. So those examples of those we'll go more into in a bit, but could include things like falls or unintentional overdose, or drowning are all examples of unintentional injuries. Intentional injuries is an injury that results from a purposeful human action, whether directed at oneself or others. So this often includes suicide or self-harm and homicide. And so looking at the epidemiology of injuries, from ages 1 to 44, unintentional injury is the leading cause of death. So really, this chart exemplifies the true burden of injuries and injuries as a big public health problem. So everything in the blue is the unintentional injuries, and see suicide is in the green and homicide is in the orange, and those both are intentional injury deaths. And suicide is the second leading cause of death for 10 to 14 and for 25 to 34. Homicide is the second leading cause of death for ages 15 to 24. And this data is all from the CDC in 2020. So really this chart, you can see the true gravity and the burden of injury as a public health problem. Unintentional injuries specifically, looking from ages 1 to 44, over time, so starting on the left is 1981 all the way through, the data goes to 2021, and you can see the different trends. So poisoning at the top spikes around 2015 up through 2020. A lot of those could unintentional injuries were or it's reflected in the table for the opioid epidemic and a lot of the unintentional overdoses that occurred then. You can see motor vehicle traffic deaths decreased over time, and also drowning, falls, and all other unintentional injuries are the three other layers at the bottom. And so breaking it down even further, for different types of unintentional injuries. So for those infants who are younger than 1, unintentional suffocation is the leading cause of death. So that often could result from a lack of safe sleep practices, and a child potentially dying and suffocating in their sleep. Then for ages 1 to 4, the leading cause of death is unintentional drowning. Unintentional motor vehicle traffic deaths are the leading cause for ages 5 to 24. And the second leading cause for ages 25 to 65. Then unintentional poisoning is the leading cause, and that's in the green for ages 25 to 64. And unintentional falls for ages 65 plus is a huge public health problem for older adult populations. So the fatal injury mortality rate, and this is data as of 2022, was 92.35 deaths per 100,000 people. And so breaking it down, you can see unintentional injuries at the top is the highest at 68.12. Then there is suicide, homicide. There's also a category legal intervention, which includes when a police officer is involved. Then there's undetermined and the crude rate, injury mortality rate at the bottom, 92.35. And so, what do these numbers mean? So, for every one person who died from an injury death, there were 11 people who were hospitalized. So, 11 people who their injuries were severe enough that they were admitted to the hospital. And then there were an additional 76 people who were treated in the emergency department and then released. And this is data an average from years 2018 to 2022. So injuries and violence have large health disparities in injury fatality rates by race and ethnicity. And we'll go into this in a little bit, but is often driven by structural inequities and barriers to getting access to resources and social determinants of health. But you can see that communities of color, so Black communities, and then also Indigenous communities, American Indian and Alaska Native populations experience high rates of injury compared to other race and ethnicities. Injuries are also costly. So in 2022, the total cost of injury was 4.98 trillion, and the total fatality cost for injuries is 3 trillion. And so to put some of these numbers in perspective, approximately each hour, a child in the United States dies from an unintentional injury, and every 4 seconds, a child is treated for an injury in the emergency room. And so we often think about how these numbers, behind each of these numbers, there is a person, people, families, communities, and really entire communities affected by injury deaths, especially child injury deaths. And that was a lot of numbers, a lot of statistics, but the public health, the news that it always I feel like is important to go along with the numbers is that injuries are preventable. So injuries can be thought of as a public health problem, and therefore take a public health approach to injury prevention. And it's so, so important and critical to have collaboration in injury prevention in order to really make advances and changes in preventing injuries and saving lives. So, the public health approach to injury and violence prevention is first defining and monitoring the problem. So, that's what we just talked about, all of the statistics and injury mortality rates, and really defining this is the problem, this is the burden of injuries. Unintentional injuries is the leading cause of death for ages 1 to 44. And all of the other numbers that we talked about. So, defining the problem, monitoring it, seeing the trends over time, like the graph that shows from 1981 to 2021 is really monitoring the problem over time, seeing how different trends change. The next step is identifying different risk and protective factors specifically for injury and violence prevention, and then developing and testing different prevention strategies. So what is effective at reducing risk, increasing protective factors for preventing injury and preventing death from injuries. And then the last step of the public health approach for injury prevention is really making sure that collaborating and working with communities to make sure that the intervention programs and prevention strategies can be adopted, are widespread, and able to be implemented effectively. And so something that's super important to talk about in injury and violence prevention is health equity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. Injury in American Indian and Alaska Native communities, um, specifically, are the leading cause of death for ages 1 to 54. So this is greater than the general population, which is 1 to 44. And American Indian and Alaska Native populations experience injury mortality rates that are 2.4 times greater than other Americans. So this is often driven by structural and systemic factors such as access to resources and consideration of various factors such as historical trauma, exposure to racial discrimination, and really a lot of underlying social determinants of health and access to resources is a huge structural barriers are a huge driver of a lot of the health disparities um, that we see. And so specific examples of structural issues that do drive health disparities could include things like infrastructure, resources, so how fast emergency services can arrive on in person, being in a rural area, the time could be delayed. And just it's really, really important to work with communities together collaboratively to develop and implement interventions. So, again, health disparities are preventable differences that populations experience in the burden of disease, injury, violence, or opportunities. And when people have limited access to resources they need to be healthy, they are more likely to struggle with health issues. And social determinants of health contribute to health disparities and health inequities. And social determinants of health are the conditions in which people are born, grow, work, live, and age. And so this figure describes different social determinants of health. So that includes education access and quality of education, healthcare access, quality of healthcare, neighborhood, your built environment. So these could include things like roads for traffic safety, for example, social and community context. Super, super important, thinking about different social supports um, in the community, and then also economic stability. So all of these are super important to think about when we think about injury prevention. So defining risk and protective factors in injury and violence prevention. According to the National Institute of Health, a risk factor is a characteristic or exposure that increases the likelihood of developing a disease or injury. So, if there is a risk factor present, there's a greater likelihood of an injury occurring. A protective factor, on the other hand, is a characteristic or exposure that decreases the likelihood of developing a disease or injury. So, a protective factor um, makes it less likely for an injury to occur. And so that was a broad overview of Injury 101 as a public health problem. And thank you so much.